If you're over 50 and you've been told your blood sugar is creeping up and the only advice you got was cut back on carbs, I want you to stick with me for the next few minutes because that advice is incomplete. And I think it's failing a lot of you. Here's what's actually going on. It's not just about how much sugar you eat. It's about whether your cells still respond to a hormone called insulin. After years of blood sugar swings, your cells stop answering the door when insulin knocks. That's called insulin resistance, and it's the real engine behind rising blood sugar for most people in this age group. Today I'm walking you through 5 specific foods. Foods you can find at any regular grocery store that help your body start answering that door again. I'll explain exactly how each one works, and I'll give you the actual research behind it, not just a claim. Stay with me to the end because the order matters, and so does the last one. Food number 1, fenugreek seeds. The first one is fenugreek seeds, small, hard, amber-colored. Here's what they do. Fenugreek is rich in a soluble fiber called galactomannan. When it hits water in your stomach, it swells into a thick gel. That gel physically slows down how fast the carbohydrates in your meal move into your bloodstream. Instead of a flood of sugar and a panicked insulin response, you get a slow, steady trickle. This isn't folk medicine, it's been studied directly. A meta-analysis published in the journal Nutrients pooled data from multiple randomized controlled trials in people with type 2 diabetes and found that fenugreek supplementation produced a meaningful reduction in fasting plasma glucose, along with improvements in HbA1c, that's your 3-month blood sugar average, and a measurable drop in HOMA-IR, which is the standard clinical marker doctors use to measure insulin resistance. Food number 2, cinnamon second, is cinnamon. And I want to correct something most people get wrong. It's not about eating more cinnamon rolls, obviously. It's about using true measured cinnamon consistently. The landmark study here is one of the most cited in this whole field. Researchers gave people with type 2 diabetes just 1, 3, or 6 grams of cinnamon a day for 40 days. Published in the journal Diabetes Care, the study found that fasting blood sugar dropped between 18 and 29% across all 3 doses, with cholesterol and triglycerides improving as well. How to use it? 1/4 to half a teaspoon a day, stirred into coffee, oatmeal, or a smoothie. Ideally with a meal that has carbohydrates in it, since that's exactly when you want it working. Food number 3, chia seeds. Third is chia seeds, tiny, but they carry real weight here, especially for people managing both blood sugar and weight at the same time, which describes a lot of my patients over 50. Like fenugreek, chia forms a gel in your stomach that slows carbohydrate absorption. But chia's real strength shows up in a different area. A randomized, double-blind clinical trial published in Nutrition, Metabolism, and Cardiovascular Diseases gave overweight patients with type 2 diabetes either chia seed or a comparison fiber for 6 months. The chia group lost more weight, reduced to their waist circumference more, and had a greater drop in C-reactive protein. That's a direct marker of the inflammation that sits underneath insulin resistance. How to use it? 1 to 2 tablespoons a day. Stir into yogurt, add to water with lemon, or blend into a smoothie. Give it about 10 minutes to gel and drink extra water alongside it. Food number 4, apple cider vinegar. Fourth is apple cider vinegar, and if you own a glucose meter at home, this is the one where you can watch the effect for yourself. The active ingredient is acetic acid, and it does 2 things. It slows how quickly your stomach empties, so carbohydrates enter your bloodstream more gradually. And it helps your muscles pull glucose out of your blood to use as fuel. Dr. Carol Johnston at Arizona State University has led some of the most well-known research in this area, published in journals including Diabetes Care. She found that vinegar consumption before a meal consistently reduced the after-meal blood sugar and insulin spike in both healthy adults and people with insulin resistance. Food number 5, fatty fish, fifth, and this is the one that works differently from all the others. Fatty fish, salmon, mackerel, sardines, doesn't slow a meal down. It works on the root cause underneath insulin resistance, chronic low-grade inflammation. That inflammation physically interferes with the insulin signal at the surface of your cells. Fatty fish is rich in 2 omega-3 fats, EPA and DHA, which are among the most extensively studied natural anti-inflammatory compounds we have in nutrition science. Research published in Diabetes Research and Clinical Practice reviewing omega-3 intake found consistent associations between regular fatty fish consumption and improved insulin sensitivity.